I'm back with more questions that you should ask your provider before having a procedure. I'm Dr. Erica R. Jones, MD. I'm a board certified family medicine physician. And in this video, I'm going to continue to let you know the questions that you should ask before having a procedure. If you didn't see my first video, make sure that you check that one out. I'm just here to help you advocate for yourself so that you understand what you may be going through as you have a procedure and as you navigate the healthcare system. So, one of the other important questions to ask before you have a procedure is when you should follow up and what signs you should look for that may cause you to follow up earlier. You need to go ahead and locate those phone numbers just in case you need them. Now, a good provider is going to direct you to all of this information, but it is really good if you just go ahead and have it on hand, like have the number programmed into your phone so that way you're not fumbling around, just in case you need to be able to access your provider after you have a procedure. That's going to be super important for you. Another question you need to ask is who exactly is going to be performing the procedure? Now, the person you are talking to, they may be performing it, but they also may have some assistance. And it's not a rude question to ask. It's actually necessary. In some teaching hospitals and large practices, the person that you met with might not actually be the person that's doing the procedure. It might be a resident. It might be a fellow, and it might be an assistant who's going to handle significant portions of your procedure. The question you should also ask a person who's going to be performing a procedure is their credentials. So look them up. Actually, look at the initials that are behind their names. Some people actually go and to get different services done, and they don't realize that they're not seeing an actual physician. They may be seeing a nurse practitioner, they may be seeing a PA. So it's okay to ask them, like, hey, who's actually going to be performing the procedure? Is anyone going to be helping you? And what are their roles going to be in the procedure? Another question you can ask is, hey, what happens if I just wait and don't have the procedure? A clinician should be able to explain to you what will happen if you don't have the procedure at all. That is very, very important. Now, you need to know if your condition is going to decline rapidly or if there's going to be room to gather more information or even to get a second opinion if you would like. And sometimes, people have very busy lives. They actually have to cancel trips. They have to move different things around to be able to go through with the procedure and, the follow-up process. There are some instances where waiting can be dangerous. So it's important that you clarify all of those things. Then when you think about how you want to ask the question, it's not that you're being rude or anything like that. You can simply say, hey, if I delayed this 30 to 90 days, what would change? Is there any meaningful risk in waiting to have this procedure? Now, I'm going to go on with the last question. Now, this list could go on and on, but these are important. This is important. You need to ask, what does recovery look like? If they give you something to use after the procedure, you need to ask specific questions about that. Providers sometimes will focus on the procedure, and recovery can be an afterthought sometimes. So that is the part, the recovery, that's going to affect your daily life that you need to talk about. You need to think about how long before you can go back to work, before you can drive, before you can exercise, before you can pick your kids up. Whatever it is, you really want to put yourself in the position of recovery and then talk to your provider about what that looks like. You want to know the warning signs that something might be going wrong and just what follow-up care actually looks like, as I mentioned before. So you don't want to leave the room. You don't want to have a procedure without having a clear picture of what your life is going to look like afterwards. You can ask this simple question. Hey, can you walk me through the recovery timeline? what to expect week by week, and what red flags do I need to be looking out for and calling you for. I'm Dr. Erica R. Jones, MD. I hope that you've enjoyed this video. Leave a comment below.